Good morning, everyone. Now, I know that there were some sound issues. I hear you, not to make a hearing thing, but let me tell you, if you cannot hear me for any reason, please wave me down. I want to make sure that everyone can really hear me this morning. I think, is this my clicker too? We're going to find this out. So my name is Camille Schrier, and I'm so excited to be here with you this morning. And I'm really honored to be able to speak here at the Ehlers-Danlos Society Global Learning Conference for a variety of reasons. And I'd really like to thank Laura Bloom, Stacy Simmons, and Faye Moran for helping to coordinate my visit today. So just some relevant disclosures. I've worked with a lot of different companies in my roles, none of which really compromise my ability to talk about this topic in terms of neurodivergence and mental well-being in Ehlers-Danlos syndrome and hypermobility syndromes. And I'm currently a postdoctoral fellow with a pharmaceutical company. Again, nothing relevant to what I'll be talking about today. So who am I? I wear a lot of different hats, but I am newly a pharmacist, I'm a dog mom, I'm newly engaged, I served as Miss America, but I am also an individual with Ehlers-Danlos syndrome, and it's something that has affected my life really from the time I was born. I was born with my hips dislocated, so I like to say my first symptom was really on day one. And it's something that I have really been challenged with. But during today's talk, I'm really going to talk about a few different things I think are important. We're going to talk about some data and statistics around neurodivergence and mental well-being in Ehlers-Danlos syndromes and hypermobility spectrum disorders. I'm going to talk about kind of my experience and what it's like to live with the complexities of having a chronic illness like Ehlers-Danlos syndromes and how that's even more challenged when you have issues with neurodivergence and mental health concerns and how that makes your life even more complex, kind of from my own perspective and from others. And then we're going to really talk about some building blocks. And throughout this presentation, I'm going to be highlighting the things that are the tools that we can use to address this both as individuals affected, but also if you're a provider in the room, if you're here to learn more about how to support individuals with these diagnoses, we're going to talk about that. And these are just kind of my objectives overall. I just said them verbally, but these are the things that we are really going to focus on today. And you're going to see some building blocks come up on my slides to highlight the things that I think are the most important things that we can take away. So let's talk about the data. So there was not really a great study. We always kind of like assumed by our experiences together as individuals in the hypermobility community that there is a link between psychological and psychiatric type diagnoses and hypermobility disorders. This was something that we kind of noticed in patterns, but there was not a great study until about 2016. This was like the largest study to date looking at the association between EDS, hypermobility, and psychiatric disorders specifically. This was out of Sweden. It was really a population study looking at, okay, if we look at this huge population of EDSers and then compare them to relevant individuals in kind of their own demographic category, how do they compare? And specifically for the EDS group, so EDS versus comparison. The risk ratio, meaning how much more likely are you to have this thing than the other group, EDSers had a 7.4 times higher incidence of autism spectrum disorder than comparator individuals. With ADHD, it was 5.6 times higher. Depression, 3.4 times higher, and bipolar disorder, 2.7 times higher. This was really the first data that we started to see in terms of, okay, we kind of suspected this, but in terms of reality, these were numbers that we were able to kind of definitively see. Now, as a scientist, I love to rip apart studies. So I think there's a lot of problems with this study. I'm going to be really honest with you. Only in Sweden, we are only looking at individuals born in the country of Sweden. So when you're thinking about, Sweden's not as diverse as the United States. The population was primarily females. We're thinking primarily white individuals. The EDS population that they were using to compare was very small comparatively. And frankly, they did all these other comparisons where they looked at EDS compared to other things and hypermobility, spectrum disorders, and comparators. And it actually looked like the siblings, they compared to the siblings, so like an EDS sibling and then a non-EDS sibling. And the sibling was more likely to have some of these conditions than the EDSer, which kind of disproved their whole point. So there's some holes in this study, but ultimately, and I was just chatting with someone before this, ultimately the data is great, but the data doesn't change the way that we treat people, right? So sometimes it does. Let me say that. Sometimes it does. But if you're seeing clinical signs of autism spectrum disorder and ADHD in your patient, you're not going to say, oh, well, that study wasn't great. You're going to treat the individual that you have in front of you. So this tells us that maybe there is an association. I don't think it proves it. I think there's holes in it, but I think it gives us a good start. Now, there's other studies now that have looked at the other way. Okay, so if you guys are on hypermobility and chronic disease like TikTok, people that are like, oh my gosh, if you're hypermobile, you might have ADHD. And there's a lot of associations looking at the other way of, okay, you have hypermobility, does that mean you might be more prone to having neurodivergence? And is there now a link? And there's now studies saying, yes, if you have joint hypermobility, it might mean that you have a higher incidence of being able to, be diagnosed with something like ADHD, dysautonomia, pain. And this study from 2022 really did, I think, a better job in linking that. And they actually said, they went all the way down to the Baton score, and they said the number of hypermobile joints that an individual has is what mediates the relationship between neurodivergence and pain. So the higher your Baton score, maybe the likelihood is that you have a higher level of neurodivergence, you have a higher level of pain, you have more symptoms of dysautonomia, which everyone in this room probably goes, duh, right? Like, we know this, again. And so this doesn't really change the way that we're going to treat our individuals with EDS, but I think it's really critical, especially to providers that are not familiar with this area. I mean, I have had so many providers that are like, wait, what are you talking about? This is all related. I'm like, it's all related, and this is just data to back up what we as EDSers have already known. So let's talk a little bit about my diagnosis. So I came out the womb with my hips dislocated, right? So I'm already starting strong. And so I struggled as a kid. I was really injured. I had chronic disease, gastrointestinal issues. I am going way too slow. I need to really speed up. I know I have 10 minutes left. Let me just tell you, I was kind of diagnosed accidentally because I feel like a lot of EDSers really struggle to get a diagnosis for a long time. I got a random scoliosis screening in school, and they said, you have scoliosis. I go to an orthopedic surgeon here in the city of Philadelphia. I'm local. And they immediately assessed me, and they were like, you have something else going on. That led me to a geneticist. I was diagnosed in the old EDS categories with mitis type 2, and after the reclassification, they basically said, okay, that became classical EDS, but then some other providers later in my life suspected that I had HEDS. I never had genetic testing until later. The long story short is I've had a long journey knowing that I had EDS, but even with knowing my diagnosis, I still faced challenges of providers believing me and understanding the challenges that I had because I don't present often as an individual with a chronic disease, which has been a blessing and a curse, because I struggle to get the help that I need because people don't believe that these certain things affect me from a day-to-day basis, especially when we're talking about a secondary invisible illness like neurodivergence and mental health. So this is our first building block, having a really effective medical support team that supports you and believes you and can help provide the care that you need. Now, I'm going to go quickly over this because it's not as relevant to today, but I have to say, through some of the work that I've done, especially being Miss America, I have learned so much about my own condition through the advocacy work. Gotten to work a little bit with the Norris Lab. Those of you who are HEDSers might have seen the preprint of the gene that just came out that they really think that they might have identified a gene for us who have HEDS, which is really exciting. So if you haven't checked that out, please do. But this really caused me to ask some questions about my own EDS diagnosis, pursue a little bit more care. It connected me with a community of people that had a shared experience. When we look at what can help us from a mental well-being perspective, having that community support is critical. It also helped to connect me with more of a medical team support to allow me to have more experts in my life who could help me work through the issues that I had. This is the reality of life for me and so many of us that have EDS and hypermobility spectrum disorder. If you look at the screen and you think that there is a piece that you can kind of relate to, me too, because my life feels like this every day. I mean, I'm struggling with my day-to-day kind of logistics of how I'm able to do things. I'm worried about my energy levels. I'm worried about where I'm gonna get water and food, and do I have a liquid IV in my bag? Am I gonna have a POTS problem? I woke up this morning with a little bit of brain fog. I'm like, can I actually speak English today? Who knows? And so this really turns into burnout for so many of us. And this has happened to me, and I feel stuck, I feel lost. And that is, again, where we have to recognize that we are not just facing physical limitations sometimes with our diagnoses, that it can be so much more than that. It becomes our mental well-being, it becomes our ability to think and interact and perform our best outside of just our physical body. So these are complex challenges for complex patients. So my question really is, are we doing enough to address both of these? Are we addressing our physical challenges and our mental and emotional challenges well enough? And I think the answer is no. And that's part of why I think this is important to talk about today, because we need to understand that treating a patient with hypermobility spectrum disorders and EDS is really treating the whole individual from their body and their mind. Some interventions that I think are, what can we do about this? I hate to propose a problem and say, okay, I don't have any solutions for this. So I'm gonna go through a couple. And I think that the biggest one is really, let me click, maybe no. Oh, that's the wrong button, that's why. The biggest one is lifestyle. And I know that I'm probably the 100th person to say this, but if you do not have the building blocks of stress management in your lifestyle, significantly good diet and nutrition in your life, and physical activity, that is where this starts. I think that doing these things is the core of what can support our mental and physical health as individuals who struggle with something like EDS and hypermobility spectrum disorders. This is the base. If you can't do these things, then medications aren't going to be able to just fix everything. And as a pharmacist, I think people think that I'm just gonna be like, here's the medication you need. I wanna get you off medications. I don't want you to have to take more than you need. So that's really important. But I do want to talk a little bit about pharmacotherapy really quick, because there's some interesting kind of theories, and it's actually something that I have benefited from. So I come into my doctor, and I am in pharmacy school. I am completely burnt out. I am I don't know what to do. I started to fail exams, which is very much unlike me. I failed 4 exams in a row in my 3rd year of pharmacy school, and I called my doctor and I said, there's something wrong. I am depressed. I am not feeling well. I can't study. I can't even absorb any information right now, and I don't know what to do. She sat down with me. We talked about my current treatment plan for my mental health, because I struggled with anxiety and depression and eating disorders throughout my life, and I was on a regimen, and she changed my whole regimen, and it changed my experience in the day-to-day. So I come in, I have EDS, I know I have POTS, and I come in struggling. And I'm like, do I have some type of other thing? She gives me all of these assessments. And she's like, Camille, you're coming up in all of my assessments as having a lot of ADHD type symptomology. Even though I'm not hyperactive, I'm exhausted, I'm fatigued. I don't present as what you think of as ADHD. But it was because my chronic fatigue, my brain fog, my POTS, my energy levels were so decreased that I just was presenting as this disorganized, unable to focus, very tired person. And so what do we treat ADHD with very often? Stimulants. Now, do stimulants have another utility in someone like me as a patient with POTS and EDS? Absolutely. So when we think about something like methylphenidate, and I shared an article here about methylphenidate in treatment of postural orthostatic tachycardia syndrome. One of the reasons we have a lot of POTS symptoms is because we need that systemic, the vasoconstriction peripherally to be able to keep our blood moving. And sometimes that's what stimulants can do. So I'm FDA approved, indicated to be able to take this medication for ADHD, but it actually is gonna help me with my fatigue. It's gonna help me with my orthostatic intolerance, having POTS. I was prescribed methylphenidate for this particular situation. It completely changed my day-to-day. I had another healthcare provider talk to me about her use of a methylphenidate product, and she literally said, this was her message. She says, my POTS is so much better, I could cry. She couldn't get her providers to actually believe that this was gonna be a beneficial therapy for her, so she went online and got a diagnosis of ADHD from one of those websites, which I do not condone. But my point is, if our providers don't know this and they don't know how to support us, and obviously this treatment is not for every patient, there's plenty of reasons why you maybe wouldn't be a good fit for this, but thinking outside of the box. Another one that I wanna talk about, because depression is another issue that so many of us do have, and our first line of depression therapy should really be cognitive behavioral therapy, but what do most doctors do? Sorry, doctors in the room. But I think a lot of doctors say, here's an SSRI, see you in a couple weeks. And that is not always the right approach, especially for an EDS patient who is already fatigued. And so when we think about the side effects of SSRIs being GI disturbances, fatigue, sometimes some orthostatic issues, these are sometimes going to exacerbate issues that us as EDS patients already have. So what my doctor ended up doing with me and was very, very helpful was switching to an SNRI, so our selective norepinephrine and serotonin receptor inhibitors. And so I was switched to one of these, which allowed it to be a little bit more activating. These are our drugs that sometimes can have insomnia type issues for patients. But again, if you're already struggling with fatigue, that little bit of energy boost can be very helpful. It helps to support my blood pressure, meaning helping to keep my blood pressure up because I'm a POTS person with really low resting blood pressure. And we'll say it's not always best in treatment of anxiety. So a lot of patients are presenting with both anxiety and depression. So again, not a perfect option for all patients, but again, a consideration that I think that we need to take into account, because I was on an SSRI for 10 years, and when I was finally switched, I think it helped me understand how exhausted that medication was making me, and that it actually was decreasing my quality of life because I couldn't do as much. So just going back to the building blocks that I think of success in this entire place, we talked about all of these. But the base, the core, needs to be our lifestyle and stress management, our diet, nutrition, and our physical activity. Then we can add on having our community support, having our supportive medical team, incorporating therapy, especially for our mental health and mental well-being. What are the techniques that we can really use to be able to support working with our brains instead of working against them? And then medications can also be a really effective tool once all of these blocks are in place. I don't think that medications are ever the only answer to solving the problems that we have as individuals with chronic disease, but I think that they can be an excellent tool in helping us to manage our symptoms. So for me, as a person that has lived with Ehlers-Danlos syndrome, I have been able to achieve a whole lot in my life. I just ran a 10K for the first time this year. That was like a challenge for myself that I didn't think I could overcome, but to me, I think was a testament to learning how to best take care of my body and really be able to support myself well, and knowing how to work with myself. Would not recommend if you are, probably not a great idea for most EDS people, but I did it because it was a challenge for me. I was able to win Miss America and go through that year during COVID, did it virtually. That was a blessing. That's a whole other thing. But really, there are so many things that you can do. I think that social media, especially in the chronic disease world, can be fear-mongering. I think that there is a lot that I see online that makes us feel like we are broken, and maybe we are a little bit broken, but you can do so much despite having a diagnosis like EDS. It does not limit you. You can push through this and do so much, even despite having this. So, in summary, I really just want to highlight these are complex challenges for patients mentally and emotionally and physically, but having that community support is critical. We do have a higher incidence of neurodivergence, and so if we're looking at getting proper care, having that comprehensive look of this patient presents with hypermobility and EDS, am I properly assessing their mental health, and if they do have a neurodivergence type tendency, and how can I proactively support them? And then I think that pharmacotherapy can be a tool when appropriate for patients to really be able to improve their quality of life like it did for mine. So that is all that I have for you today. Thank you so much for listening, and I am happy to answer your questions during the Q&A session. Thank you.